It's interesting because the pain and the itch fibers are related in the skin. And because there are sensory nerve fibers that have cannabinoid receptors in the skin and throughout the immune system, even on the hair follicles, they can be influenced by either our own cannabinoid, which is called anandamide that we make, or a topical cream, a cannabinoid that works. And they've even done studies in patients with itching from end-stage renal disease, which is very severe and intractable, hard to get rid of. And they found that 38% had a complete cessation of their itching, which is almost unheard of in that population. Then there was another study done, and 83% of the patients had no more itching with severe chronic itching, prurigo, lichen simplex, which had been intractable up to that point. And that's with a topical CBD cream with a high enough concentration that it's actually effective. It's like a whole new industry. It's unbelievable. I've spoken at about 8 medical cannabis conferences around the country and also in Canada. And it's amazing, all the science, new science going into it, and so much we have to yet discover about which cannabinoids help in which diseases. There are actually over 130 cannabinoids, and CBD is just one of them, but it's one of the ones that we've discovered is the most prominent so far. But there's CBG, CBN, and many other cannabinoids, as well as THC, which does have psychoactive properties, but in a small amount in combination with the CBD sometimes activates the CBD. And we have so much to understand because this is also a very personalized medicine, cannabinoids. People react very differently depending on their metabolism and how they absorb things to different terpenes in the cannabis sativa plant and different cannabinoids. So not only have we got a lot to discover on all of the cannabinoids and all of the terpenes in the cannabis sativa plant and which ones would work for which diseases, there's also an element of personalized medicine and which one would work for each person individually. So there's several big researchers across the country who are collecting databases on a patient's experience on which combination of CBD, CBG, or different amounts of THC or THCA works for them in their disease. So it's going to be combined with a lot of data in order to try to figure this out. And there's also many medical and scientific analyses now beginning. It's really amazing when you go to these medical cannabis conferences and you meet the people who are really the frontiers, like Ethan Rousseau, who developed who discovered what the endocannabinoid system is, and he helped develop the first anti-seizure pharmaceutical with GW Pharmaceuticals. He's an amazing person. Sue Sisley, she's been a warrior for medical cannabis. And this is very different from recreational cannabis. We're talking about helping patients and the science behind helping patients and the double-blind studies. And it's not about getting high. It's about pain relief. It's about improving the quality of the patient's life. When I took care of wounds in the past, it's so painful. You would have to, you cut out the dead area, and it's so painful for the patients, and they're so hard to cure. Very difficult. The topical has shown to help. They've been anecdotally for hundreds of years. It's native people have used topical cannabinoids for wounds and for skin care. And actually in China, they've been using topical cannabinoids and hemp oil for beauty for thousands of years. So anti-aging and beauty associated with hemp is actually not the new in thing as they marketed the new CBD in skincare with the celebrities. It's actually the old becoming new again. But as far as the wounds go, there was one case study done with 3 patients who had terrible wounds from pyoderma gangrenosum, terrible pain, and the topical cannabinoid actually reduced the pain and helped with the proliferation of skin cells, of new cells, and helped the wounds shrink. And the patients were able to reduce their opioids, all 3 of them. And there's many, many anecdotal reports, but this was a double-blind study recently in the literature, and I'm really hopeful that a lot more research will be allowed to be done, and we'll have so many more studies as soon as the government becomes more scientifically based. This is an incredibly explosive, promising new field. I was just interviewed by the New York Times magazine for CBD and skincare, and it's really the in thing for skincare, but it's also a wonderful thing as an adjunct for pain relief. It works on the endocannabinoid system, which is in the skin. There are CB1 and CB2 receptors, so cannabinoid 1 and cannabinoid 2 receptors throughout the whole skin, including the appendages like the hair follicles, the nerve fibers, the immune cells, the basal cells, the melanocytes and the sebocytes that make sebum. So anti-aging, the endocannabinoid system, and our own endogenous anandamide, which is our own cannabinoid that we in our body have, or putting on a topical cannabinoid, works on the basal cells. And they regenerate, and it increases the regeneration so that there's new skin cells on the top and they look younger and more radiant. That's how it would work. So far, that's what we know.